We're going to move swiftly on now to Dr. Imran Qureshi, because I know he's here. He's from the Ipswich and East Suffolk CCG and Susan Conker Health Watch Suffolk. He's going to talk about commitment to co-producing real change. So Imran, thank you.
Thank you, David. I wonder if you wouldn't mind if Sue started off, because she's got a slide, and then I can come in at the end of that, if that's okay, Sue?
Is Sue there?
I am, yeah, that's fine, yeah. Have you got the slide to put up, or do I need to share the screen?
I think it's up.
Ah, that's it. Okay, so hello, I'm Susan Conker. I work as the co-production facilitator at Healthwatch Suffolk, along with Andy, who spoke at the beginning of today. I'm here to feed into the conversation today the benefits of an approach of co-production. So it's good to all agree on what co-production means. There are many definitions out there, and what I've learned is that is okay, because having a meaning that fits the environment or the specific project is more important than everyone agreeing on the same one-size-fits-all version. So co-production is simultaneously an activity, an approach, and an ethos which involves people who use services, members of staff, and communities all working together, sharing power and responsibility across the entirety of the process or system. Now, because co-production is an activity that we can do, and it's a culture, a mindset, and a way of life, the words can seem overused, they can sometimes be misused, but they can be properly used to promote how people have worked together in an equal way. So the importance of co-production within this conversation is that it must go from the planning and design all the way through to monitoring and governance of a system, of a project in its entirety. That means that organisations must listen to a range of views and not just the easiest to find or those that are already well informed. So there are growing benefits to the values of this approach, and one that is vital during times of government cuts and austerity, particularly at this time during the changes that are happening in the recovery from COVID-19. So co-production as an approach can make the best use of resources. It delivers better outcomes for people who use services and for their carers and families. Importantly, it builds stronger communities and it develops citizenship. So the principles are the foundations of working together in a way that we all agree. So on the right-hand side of the slide, you'll see a list of ingredients. Now, these must be present in our recipe of co-production. So these 6 principles were locally agreed at the end of last year with a wide variety of people. We put on 2 community events and we used an online voting system. And this had the aim of everybody agreeing on what co-production is and how to do it well. So I'll go down the list: accessibility, trust, equality, mutual benefit, evaluation, and diversity. And today I think we have time to quickly focus on 2 of these principles, diversity and mutual benefit. So the process of co-producing this recipe was really interesting in terms of diversity, because the order that you see these principles written in there is the order of importance that people voted as being integral to the co-production process. And you can notice that diversity, although it is there, it is at the bottom. And I think this showed that at the time, people involved did lack a shared understanding of the term diversity and its importance. And moving forward, I think we are learning more, but we must focus on how to take a positive action to ensure that diversity is really present. Secondly, mutual benefits. This means that people get something back for putting something in. So personal benefits are not always financial. but an organisation should be prepared to provide funding in order to offer payment for people's time and their expertise. And this provides more of an equal and valued experience between everyone who's around the table in co-production. We'll move over to the left of the ladder. Now, this ladder analogy, it's commonly seen in co-production guidance online. And it shows that there are differences between true co-production and other forms of engagement or participation. And that is quite a big topic, so I'm not going to go into that in detail today. So moving into the middle at the bottom of the slide, there are unsaid myths and assumptions about why Black and minority ethnic individuals are less likely to become involved in co-production opportunities. But I must state that these aren't backed up with any evidence at all. And in fact, the evidence points towards the opposite facts. We need to focus on the existing strengths that we have in our communities. And there are three main favourable factors that currently enable their participation. So we need to focus and celebrate these. So one is a strong history of self-help and direct action by Black and minority ethnic communities. Two is when properly supported, Black and minority ethnic service user participation is proven to work, and there are many examples of it. Not necessarily in academic literature, but there are examples in stories. And three, social care professionals are working with Black and minority ethnic service users as allies and advocates, and this is shown every day. Healthwatch Suffolk, we host co-production pages on our website, so you can find more resources, tools, news and updates. And if you want to join the mailing list, you can join that and keep up to date with anything that we're doing. And also opportunities to support this amazing approach that is being utilised a lot more at the moment. Co-production is the way forward, and it's always going to be creative, it's innovative by nature, but it is becoming a go-to approach across the public sector. And luckily, COVID-19 has accelerated the uptake of a co-productive approach. And that's because it does make sense. It makes sense for value, for relationships, for longevity, and it creates an ownership amongst all members in our society. So thank you very much for having me today. Imran, did you want to?
If David will allow me a couple of minutes, if that's okay.
Yes, please. Yeah. No, please do.
Yeah, so I mean, thank you, Sue. That's an absolutely quick run through of what co-production is. Just a couple of things from me. First of all, the statement hard to reach. For years, we've been using this statement, and it's got some for me, some very negative connotations. It implies that a community is hard to reach. There is no community that's hard to reach. What we have are seldom and never heard voices. And I'm coined that phrase, and I had Andy Yakub use that, and it's really struck a code with me. Equality of access is the other misnomer that we have out there. It's not the same as equality of outcomes, and there is a major difference here. And why is outcomes important? Well, because we have a moral duty as well as a socioeconomic duty. We know it's more expensive the later we intervene, so the more we can get and improve our outcomes, the better our societies and the more money we have to spend on this. And then I just want to come back to the how do we do this? And the phrase I like to use is a rigorous and relentless focus on co-production from thought inception, as Sue's already said, right the way through to policing. So we need to use our communities to do this. And it's not just health. I know this is really important. Andy's already touched on this. All the wider determinants, David, you've mentioned as well about policing. All these factors influence health and our health choices and our health outcomes. So to ignore any one of those is to the detriment of our system. Yeah, the final point I want to make, and I know Ed's listening, and I've said this before, but we have to recognise the need for a differential financial investment to achieve those same outcomes, because it just costs more, and we know that, and we shouldn't be afraid of using that, you know, and saying that and recognising that. So, David, thank you.
And just to back that up, working with young people in care, if we invest the money into the children when they're young, we would have far less problems later on with the mental health and the prison and all those things. So I'm with you on that. We are running short of time, so thank you both for that. Thank you very much.